Support comes from the Janice Hawkins Cultural Arts Park on the main campus of Troy University, featuring the International Arts Center, the Fred Nall Hollis Museum, and the Huabaoju Gallery. More information at troy.edu/artspark.
I'm Kate Nesbitt, and this is The Rounds, a podcast where nursing professionals, community leaders, and nursing faculty share stories and practical advice for current and future nurses of all specialties. I'm joined by nursing student Brooke Mosley. And Brooke, today we have a really special story that we want to share with our listeners.
Yes, today's episode is much bigger than just nursing education. We're talking to Olivia Thurman, a nurse who's previously worked in hematology and oncology, which is also known as HEMOC. Olivia's daughter was born with a genetic condition that caused her to spend 9 months in the neonatal intensive care unit. We'll talk to Olivia about how she's doing and how her experience as a nurse has helped her care for her daughter.
How are you doing with kind of managing both your daughter's condition as well as just being a mom? I know that you're not necessarily currently practicing, but how are you doing specifically?
Yeah, I mean, it has been hard. We spent 9 months in the NICU due to like her type of dwarfism that she has. It's called cartilage hair hypoplasia and anoxidic dysplasia. It's long. We call it CHH, really for short. But that type of dwarfism comes with the type of immunodeficiency, and it also is common for them to have Hirschsprung's disease, which is an intestinal disorder or disease. And that's what really kept us in the NICU for so long. She had 4 abdominal surgeries, and Hirschsprung's disease is really where you have those. She doesn't have the cells that allow for the motility of the intestines to work properly. So she's having to, get this portion of intestines that does not have those cells, they remove. And so it's been a trial and error with that, really. We still are far away from getting her fully reconnected and things like that. She has 4 different stomas and a G-tube, and then something called, they call it a J-tube, but it's where her intestines is pulled up to her abdominal wall, and they have a feeding tube basically in there. And this may be a lot of information, but for her to be able to get the nutrients that she needs, we're pulling stool out of one ostomy bag, and we're basically refeeding it kind of like you would just regular formula, and we're refeeding it back into that other portion of intestines to help her be able to absorb more nutrients and medications and things like that, so she can gain weight and thrive until we're able to try and reconnect those portion of intestines again.
Yeah. Have you, in your experience, have to deal with a patient that's like her before?
Actually, I have not. Even with my experience as a nurse, I think I could count on my hands how many times I've had to deal with ostomies. So the ostomy part of it and has probably been, new for me, but now I'm a pro.
So when you're ready to go back, they know exactly what you're going to be doing.
Yeah, I feel like especially when you're a new nurse, if you haven't done like those skills before, I feel like the only time I really would see those if I would float to another unit. And I was almost intimidated by it. And now I'm like, why was I ever intimidated by an ostomy bag? Like,
So,
out of all the things I deal with, central lines and everything, I was like, oh gosh, an ostomy bag. But now I'm like, oh, you're crazy.
the day they first showed me an ostomy bag in like a lab and like explained everything, I was like, there's no way. There's absolutely no way that even works. And then I had a family friend who actually had to have one put in place. And from talking to them, talking about the smells and everything that comes with it, what was the most thing that caught you off guard when it came to that? Because I guess I never even recollected, this essentially is feces. It's going to smell.
I don't think it was the smell. I think it was really like me being able to like touch all over her intestines, and they actually do not have like it does not hurt them. They're very vascular and they bleed, but they do not hurt if you move them around or anything like that. She will literally grab her intestines and pinch them, and I'm like, oh my gosh, girl. But I feel like that's probably the most thing that I was kind of in shock by, because I was like, so this does not hurt her? They're like, no, it actually doesn't. So
That's incredible. And that's definitely something that, being a mom who's trying to advocate for essentially your one and only patient, and then later on when you're able to when she's better and you're able to enter, the workforce again and everything, you're more able to kind of explain that to parents and also just
yeah.
know that that's something that's like a cool little fact. I did not know.
Mm-hmm. And I thought since I feel like I'm a pro at this now and I'm wanting to get back into work whenever she gets help her immune system and everything is good. I don't know if y'all know that there's like ostomy nurses and like wound ostomy nurses that will come in intermittently and just check on you. I do all of her stuff, but like a lot of times there's patients in here that they have to change the ostomy bags and things like that. And so I was interested because I kind of like it now, but you have to actually go back for an extra year of schooling, because I was like, I kind of am interested in this. How do you get into this job? And you actually have to go back for a year of schooling for wound care and ostomy kind of training, education stuff. But if it weren't for that, I think that would be something I would do. But I'm like, I'm already trying to finish FMP school through all this, so let's just stay where I'm at.
And talking about schooling, how did you get into wanting to be in maybe pediatric in general, but also the HEMOC portion as well?
I feel like in high school and college, I always loved babysitting. So I feel like I just loved taking care of kids. So that really is what drew me into pediatrics. I don't really say that I have like a certain situation that happened or anything like that. And then HEMOC, I feel like when I started nursing school, that was always just something on my heart and something I wanted to be, a HEMOC BMT nurse. I don't know why, but that's what was on my heart. And it was the first job I interviewed for, and I got it. So I was excited, and that's what I did. And I stayed there because it was wonderful. It had its challenges just like any other job, but it's also encouraging. And, you have to be that encouragement for the kids because they do have their hard days. And a lot of people think that, oh, that job is so sad. And it is sad, but you also put on that smile to give them the smile that they need,
Yeah.
Do you have any advice or anything for that current nursing student right now that's listening to this that's maybe considering pediatrics or considering HEMOC while still in school?
Yeah, I mean, I say go for it because there's so much opportunity out there, and if you don't like it, you can change. And there's going to be good days and there's going to be bad days, of course, just like any other nursing. But I say go for it.
What are some of the challenges that maybe they would think they're going to have to face that, just like you were like with the dressing change and everything of like, I don't know why I was so scared of this. What's something that they might anticipate of like, that is a big challenge, a huge scary thing that I don't think I'm going to be able to handle. And then they're going to do it and they're like, well, that's the easiest thing. What's something that they don't necessarily have to be scared of?
Do y'all know what ports are for some of the cancer kids? They have ports.
Vaguely. Is it just like an area where you can give medicine?
Yes.
Is it
Yeah. So
mostly
it's
in
kind
your
of like a
chest?
central line, but there's a port in their chest, and you actually have to have. There's a certain needle that you access the port with.
Mm-hmm.
And I feel like that was also something that was intimidating as part of the job, but it was a skill that I ended up loving being able to do. I was like, oh, you need a port access? Yeah, I'll go do it for you. But yeah, I feel like because that's a sterile procedure as well. And I feel like a lot of times, even as a new grad, that might be something scary for you to do. But honestly, like I was thinking about this last night, practice, 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 even in nursing school. Get out there. Don't be afraid to ask the questions. Don't be afraid to be the first one to volunteer to go do a skill, like start an IV, or because that preceptor or whoever is with you is trained and they will help you walk you through it. So don't be afraid to ask the questions and get out there and do it because it's just going to make you a better nurse.
I personally, sterility skills are so nerve-wracking. You go in there for that check-off.
Hey, and
Your hands are
yes, those
shaking.
checkoffs. Oh gosh,
Oh, goodness. I have one
they
tomorrow.
are so scary. And let me tell you, they're nothing like doing it on an actual real person.
Yeah.
Especially a child. If they're in there screaming like a toddler and you're having to put a catheter in or anything like that, it's nothing like that because you're having to hold them down and trying some way to communicate with them and get down on their level to try and tell them it's not going to be as scary as you think it is. I feel like that's probably one of the key things of being a pediatric nurse is just getting down on that age level and talking to them and trying to communicate with them in a way that they're going to understand that it's going to be over quickly, and distraction, like getting them to watch something or playing with them, singing with them.
I know we're even told, like, as the nurse, don't be afraid to be the bad guy in those pediatric situations. Let their parent be the good guy. Let them be the comfort. You don't want to essentially turn them against their parents. And I'm like, I don't want to be the bad guy. I don't want them mad at me.
Yeah, and me over here, I'm so picky about my central line dressing changes that I want to do them. So I'm over here having to
Yes.
make her mad and do it. But I mean, I want it done the way I want it done.
Yes. What's some of the like most rewarding experiences that you got to have as a pediatric nurse, and even just some that like what have been some high points for your daughter's recovery?
Yeah, so I feel like it's just the little things as a nurse that get you through the day and get those kids through the day. Like when they haven't had a good day in weeks and weeks, and then you're finally able to see them smile, that's just so encouraging to you. And I remember one night I had a little girl, she was probably 8 or 9 years old, and I haven't had her in a while, and I finally had her, and she was so excited, and she wanted to play hide and go seek on the unit. And it was so much fun. It's just like getting her to be able to smile and actually be a kid, like those are what's so important because they are stuck in this room for so long. And even for me, it gets depressing. You're in the same four walls and it's so hard. Just being able to get out and be a kid and walk around the unit or play games, or just like for my daughter, we were in the hospital for like probably 2.5 months or so. And because of her immune system and just having a new transplant, we weren't able to like go outside of this, or she wasn't able to go outside of this room. And then finally, when we got the news that her immune system, like she accepted this transplant, we were allowed to like go outside to a special garden that was made specifically for the BMT kids. And it's just things like that help you get through the day and help you get through this journey. And it's the small things, it's small to you, but it's big to the patient.
Yeah.
So on my side of things right now, it's big to me because we're able to get outside and get some fresh air. So.
Oh, yeah. And then I know we had that historic snow day with the South recently. Did y'all get to go outside and
Hey, you know what we sure did?
Yes.
I was determined. She's a little over 1 year, and she probably reacted like any other 1-year-old would, but we wrapped her pumps in plastic, and we went outside, and we made a snowman, and we made a snow angel.
That is so
it was
adorable.
probably for me, but it was good for her to experience, but she's probably not going to remember it, but I will.
Yeah, I mean, most of those memories prior to like 3 or 4 years of age are just strictly for the parents to also be a kid with their kid and be able to experience that from their point of view. I completely understand.
Yeah,
I wrapped my kids up and they spent 5 minutes outside. They didn't spend that long. And then they went right back inside and took it all off. And I was like, well, at least you saw snow. And at least you're going to remember that you saw snow.
As a pediatric nurse, so you go in, you think, as a nursing student, I'm going to think unicorns, rainbows, I get to be with kids all day. It's going to be the best thing ever. But I know there's got to be some, like, misconceptions or something that you weren't quite expecting going in as a pediatric nurse.
I mean, I feel like a lot of the misconceptions, especially in nursing school, you just hear a lot of negativity about, oh, you don't have to just take care of the patients. You have to deal with the parents, too.
Yes.
I feel like I heard that all the time. Like, why would you want to do that? But I feel like that's something that also makes this job special because you're not just building a rapport with the patient or the child, you're also building rapport with the parents. Because even me being on this side as a mom, they're not just being playful with Elliot, but I'm also confiding in them because it gets lonely and they want someone to talk to. And so be that nurse that will talk to your family and also play with the kid, but get to know them. Ask them where they're from and, ask just the sweet questions and get to know them because that's made a difference being on this side, I feel like. And it's just so, when you get to know somebody, it just makes the day so much better because you can go days without seeing them again and then you see them and they have you as their nurse and they're just excited and it makes your whole day better.
Yeah. Has there been any like communication skills that you've had to learn or that you've at least appreciated that your nurses have had for that have been, assigned to your daughter? Has there been any of those communication skills that you would say you would need as a pediatric nurse, especially talking with those parents?
I feel like just listening, and I know that most nurses can't fully understand, like they are here working in and out, but I guess just sitting there and listening and trying to sympathize with them because I feel like sometimes I'm like trying to talk to somebody and or talk to one of the nurses and it's just hard. It's just
Yeah.
plain hard to not want to just sit there and cry with them talking to you.
Yeah, absolutely.
That reminds me, like one of the situations that happened while we were during this journey for the BMT. My daughter was possibly having to be transferred to the PICU, and the nurse practitioner comes in and trying to assess her and everything, figure out what she's thinking, what she wants to do. And I can't remember the exact words that she looked at me and said, but she was like, "So do you want me to have like a nursing educated conversation with you, or do you want me to talk to you as mom?" I said, both.
Yep. Mm-hmm.
I need like the gentle conversations, but I also want you to be honest with me and tell me what you think.
Yep. Yep. How do you manage that emotional toll that kind of comes with working in this area? Just the constant sadness that kind of comes with it, seeing all of these sick little babies that you want to love and you want to see happy and you want to have those special moments. But how do you kind of manage that emotional stress of it?
Yeah, I feel like that's probably the most challenging part of the job is separating work from home. Like there are going to be great days where there's not anything that's super sad that happens, and then there's going to be times where you do have a patient that you've gotten to know and maybe they do pass away or maybe they are super sick. And I mean sometimes you do take that home and you've got to find a way to separate that a little bit. And the way you do that is hard.
Do you have any tricks you used to do? I know going into a kid's room to like give them a shot, that would send my anxiety through the roof because I know they're about to cry, I know they're about to scream. Did you have any like tips or tricks you would do to help calm their nerves before you gave them an injection?
A lot of times we use something called lidocaine cream, and you put that on them. It can numb their skin a little bit before you give them an injection. We do that a lot when we're accessing a port too, especially on the littles. It's really depending on the age. Like, what are they into? Are they into Disney princesses? Can you sing Disney princess songs to try and distract them? I feel like a lot of kids are into Bluey now, so I don't know, maybe watching Bluey.
Yeah,
Or just honestly, just like talking to them, like, or are there any characters on your shirt? Can you pick out something like, oh, what is that on your shirt? I don't know.
Yeah,
Distraction is key.
There was one, like, I think doctor who had like a viral video or something. I want to say it was a doctor, but he came in and he sat down with this mom and this, say, 1-year-old, a baby in a diaper, and he made them look all over the place with his hands and then would quickly stick them and be done. And the baby didn't cry. I was like,
yeah.
That is magic. Is there anything as a nursing student anything that you, maybe advice you would have gotten or things you wish you would have paid more attention to?
I think it would really, goes back to what I was saying about don't be afraid to do the skills. Don't be afraid to be the first person to volunteer because it is intimidating. And like I said, it's nothing like doing it on an actual real person versus the mannequins, especially like trach care and things like that. I feel like that's one of the things that was intimidating to me. But I would go back to don't be afraid to go in there and do that because it can be intimidating, but there is that person that's right there with you that's going to walk you through it. I know some people may not be intimidated by skills like that, but I know as a nursing student, just getting in there and doing checkoffs was the most nerve wracking thing to me. And now I look back, I'm like, oh my gosh. First of all, this is nothing like doing it on a real person, but it's just so important to practice, 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 and to be confident that you can do it.
I know checkoffs, they make you feel almost like you're up on a stage all by yourself, and it's so nerve-wracking. But I keep telling myself when I'm going to be in that room, I'm not going to be by myself. There's going to be another nurse. There's going to be someone else in there. It's not all you, make or break right here, right now, like checkoffs make you feel.
Exactly. And like if you get a patient, say you're a new grad and you get a new patient and there's something that you really don't understand or you don't know what you're doing, don't be afraid to ask someone because it's better to know what you're doing than to go in there blind. So there's not stupid questions. It's always important to just ask.
Something I've learned even, you may think that question sounds stupid, but would you rather yourself sound kind of dumb or your patients be alive? Would you rather save that patient?
Or have the best care.
Yes.
I mean, hopefully not everything is life or death, but
you have
maybe
to humble
just
yourself
a
a little
care.
bit.
Yeah. Is there anything that you would want to tell a nursing student who's still kind of deciding on a specialty, maybe not specifically about pediatrics? Is there any advice on just finding out what they would want to do?
There's so much opportunity out there and you don't have to rush into something. Really get a feel of it when you're in clinicals. That's why there's so many different med surge, pediatrics, OB. Again, get in there and actually do the skills because that's what's going to let you know if you like something or not. Go in there and be in there for a delivery for OB because if you don't go in there and see it, how are you going to know if you like it or not? So it's so important to just try and be there and be attentive to things that are going on because it's going to help you figure out if you like something. If you may not want to go in there and stick this mom for an IV that's about to have a baby, but go in there and do it because you're going to figure out if this is something that you like or not.
When you were either in school, outside of school, and you decided you wanted to be a HEMOC or a pediatric nurse, were there any additional certifications or trainings you had to have?
When I was hired, I did training for something called PALS. It's just Pediatric Advanced Life Support. But normally if you're hired on like a children's hospital, they offer that to you. So I don't think there's anything that you necessarily have to do prior to being hired on, if that makes sense.
Yeah. Is there any last advice you kind of want to give to any of our nursing students and anybody who's listening to this podcast, because this isn't just for nursing students, but nurses in general who want to learn more about maybe different specialties or whatnot? Is there any advice for anything that you want to kind of leave them with?
Stay strong. Nursing school is so hard. Take it day by day. Keep studying. I know it can be so difficult to just keep on studying the same thing over and over again, but it's going to make you a better nurse. And you may not think that you're going to remember these things, but you will. And I guess just, like I said, practice and you can do it.
It takes special people who want to start the program and stronger people to finish it, let alone going into all these
I remember during finals and stuff just squalling, saying, there's no way I'm going to remember to be able to take this test. There's no way. I remember it like it was yesterday. I called my mom, screaming, crying. This is terrible. I mean, look at all this information. This is all of our information that we've learned all year, and we're having to take a test on this. How am I supposed to remember this? But guess what? You will remember it, and you're going to do just fine.
Yep.
Yeah, so I have one question for you about being a nursing student.
Yeah.
What semester are you in, and do you know what you want to do?
I am currently in second semester. I just took my first pharm test yesterday. But
Who do you have for a farm?
I have Miss Lauren Gilcrease.
She's the best.
I love her. I love her so much.
You
But
tell her I said that.
I will. I
I'll
will.
never forget her. She's wonderful.
She is. I was actually
And she's
sick
so
on Monday,
helpful,
and
too.
she like FaceTimed me into class.
Yeah, shout out to Miss Gilcrease because she's probably going to be listening to this later.
But right now, I love ER, and even like a trauma center like up in Birmingham is what I've looked at. I love the fast pace. I don't have much time to overthink. It's based off my instincts.
Well,
I know that.
I feel like I feel like if you like that, look into. I don't know. I just thought it was really cool. The flight, being on a helicopter, getting to do that kind of thing. I feel like that's awesome.
For some background, Olivia, Brooke here is she's a nursing student. She also happens to be my cousin, and and so my husband is a flight nurse. He actually started out as a flight paramedic and is now a flight clinician in some areas, but he's a flight nurse and he's still practicing. And so when Brooke was first looking into coming to Troy and looking into being in the nursing program, he was right there in her ear going like,
he's been trying to recruit me since
yeah,
day one.
absolutely. He recruits
Oh my gosh,
anybody and everybody.
I mean, that is your perfect opportunity just to get out there and kind of do a clinical thing with him. You got to do it.
Yes. We've got to
Absolutely.
schedule it.
And yeah, he would have so much fun doing that.
That's awesome.
Well,
Okay, well, I wish you the very best of luck.
thank you so much for joining us.
Thank you. Good luck in the rest of your nursing school.
Thank
and I
you
hope
so
you find
much.
something that you love.
Well, we've come full circle on this episode of The Rounds. We want to thank our guest, Olivia Thurman. But before we go, don't be afraid to press that call button, record a voice memo with your question for our guests, and send it to KROSS120311@troy.edu. It can be anything from, how do I get started in nursing, to, why does my elbow hurt when I do this?
You can stay up to date on new episodes of The Rounds by subscribing on the podcast platform of your choice. And be sure to share with the nurse or nursing student in your life. The Rounds is recorded in the studios of Troy Public Radio and produced by Austin Toy, Kate Nesbitt, and the College of Health Sciences at Troy University.
So, until next time, I'm Kate.
And I'm Brooke.
We'll see you again next month when The Rounds returns.